Hey there, this is Dr. Bob McIntosh with HealthFair Chiropractic, and I am here to talk about HealthFair and give you the details on it. I want to tell you the last two locations and then the pickup. So that's what the information I'm going to give you, but I'm also going to show you how and explain how this is one of the things that we try to do out of all the things that we do that is headed towards saving you hundreds if not $1,000 per person that goes through and does a HealthFair panel. So I want to empower you to be able to take and make healthy choices, but also learn about the system that's sitting there billing insurances and stuff like that. So and I mean, I don't know if you guys have gotten this. Insurance rates, do they keep going up or do they keep going down? Mine keep going up and my coverage keeps getting worse. And so when I do this, gonna give you this information. This is for you and me because I'm learning this stuff and I'm trying to pass this to you to be able to help you improve the health of your families, help you improve the health of your community, because I live here too. So here we go. HealthFair draws. The last two left are Belle Fourche and Spearfish. Belle Fourche is this Saturday, January 14th from 8 to 11. It's at the Community Center on National Street. And then next week is going to be Spearfish, Thursday and Saturday, the 19th and 21st from 8 to 11 at our clinic on Hudson Street across from Common Grounds. So that's the locations. Now, what's in it is your HealthFair panel, the huge, complex HealthFair panel that will guide you through as how to read it as well, those types of things. It's $45, okay? Now, what happens is a lot of people will be testing to see what their HealthFair or what their New Year's resolutions are improving. So you can take this test and then you can assess yourself about 3 months later or 6 months later. And you only get in your health care or your health insurance one set of these labs a year, and you end up with not being able to measure improvements and things like that. And what happens with this too is a lot of times people don't understand that when this is billed out to insurance, this is charging your insurance around $759, okay? And so even though insurance covers some of these things, what's happening, it's driving that cost. So if we take a town of 100 people that went and got their blood work done, we're gonna talk about $759. Let's add 2 zeros. So $75,000 of billed towards insurance. That's only 100 people. And in our area, we've got 100,000 people over the Northern Hills, maybe even more. And so now let's extrapolate that into even more and more money. That's where the money goes as far as it doesn't go straight to the doctors. It doesn't go to the labs, doesn't go to the technicians. It goes to the healthcare conglomerates that are out there. And so what happens is, I want you guys to understand this very well, is these HealthFair panels are for you, but you need to know that you can take and test these things because you don't have to have a doctor always read them. You have them help you, guide you through this if there's red flags and if there's problems that can be identified. My dad has cancer because of this. Sorry, let me say that this way. He has cancer that was identified because of this, and they were able to catch it before it was a great big problem. And so this HealthFair profile, it tests your blood. So there's red blood cells and there's white blood cells, and the white blood cells are our immune system. If you're sick, your blood cells go up. If there's leukemias, things like that, there's changes in the levels of them. And so it ends up showing that there's big problems in your white blood cell counts or your red blood cell counts. If you have cancers like bone cancer, if you have liver cancer, if you have pancreatic cancer, any of these cancers consume blood cells and they eat them basically. They suck the life out of them and they cause people to be anemic. So it makes little blood cells, and so your blood cell counts can be identified and predictive of cancer as well. So your lipid panels are going to be like your cholesterol, your HDL, your LDL, good cholesterol, bad cholesterol, good, bad, whatever it is, and then your triglycerides. You can take those. You don't just go off of this. You have to go off of lifestyle. You have to go off of diet, because you can take some people with high cholesterols that have a very healthy lifestyle and they don't have any cardiovascular risk. And so even some of the research right now is saying that do not go and correct cholesterol with statins, because statins are causing problems like diabetes, chronic aching muscle and joint pains, things like that. So then there's on the hemogram, which is going to be on those blood counts, it's going to talk about the sizes and the shapes and the colors and if they're carrying iron. So then there's an iron panel in it as well. Test your iron. It tests those. It can be whether you're anemic from bleeding internally or cancers, or your body just doesn't make them right. You're low in energy, and you just can't. You don't feel like things are right. You get dark circles under your eyes, and those are signs of anemia. Thyroid test is also another one that's in it. It's a test of whether it's a screening of thyroid to be able to tell if it's functioning high or functioning low. It's not the single test that you always go to, but it's a screen that'll catch a big percentage of the problems that are out there. So that's in here. Your uric acid levels, so people that have a diet where they eat lots of beef or even some alcohol content, or what happens is uric acid crystals build up in their joints. It could be in a knuckle or a knee or a big toe, and it ends up developing something called gout. And the people that have gout, you know who I'm talking about. You know who you are. This is severe pain, and like the sheets at night can't touch your big toe. You have gout, and this uric acid level, you can start changing things in your diet and changing supplements that you're taking some medications working with your medical doctor or your chiropractor as far as diet changes. They can help you be able to reduce those levels, and then monitor again, check it again, see where your gout levels or your uric acid levels are. And then last, there's going to be some additional tests that you can add to it. It's going to be for the guys that are over their 40s but they have a family history of prostate disease. It's literally $30 to be able to get this test done. It's very inexpensive, but it has to be tied together with your annual checkup. So when you have your annual checkup or every 5-year checkup, you end up bringing this blood work in, and you can be prepared for your visit. That way you don't have two visits, two charges for 2 visits for a follow-up, those types of things. So your vitamin D levels, that's going to be another one. It's $50. So normally if I just send you up to the hospital, it's going to be, I've seen places starting to take and change prices, and they're going to be around that $90 to $180 as far as the blood work and what they're charging for vitamin D. This time of year is the lowest exposure of sun that we get, and the sun's at a sharper angle, so we don't get exposure to sunlight. And so then we don't make, or our skin doesn't make, the vitamin D because we don't get it exposed. And see, I'm pretty pale. It's proof. So get your vitamin D levels checked, because what happens is you get that seasonal affective disorder, kind of like that anemia. You get that, oh man, I'm just fatigued. You don't want to do anything. You just don't feel right. The other thing is there's some research studies that are talking about with people that it's not that you have osteoporosis, but your vitamin D levels are low, and so it makes your bones flexible, or when they become flexible, they become painful, and so you ache. You have lots of aches and complaints as far as joints, things like that. Pain processing can be helped by vitamin D levels. If they're low, you bring them up. People's pain levels drop just because of the neurology behind it. And then vitamin D is also a major player in our hormones. So if you're moody this time of year, what happens is you can check your vitamin D levels, and it can be high or low, or most likely not high. I can't say I've had anybody high just naturally ever. And then I can say, as far as with the HealthFair profiles, people around here respond really slow to even nutritional supplementations. So the national standards are like 600 IUs of vitamin D. People take 2,000 or 5,000 a day around here, and they can't even keep their levels normal. But it's also important that you know your levels, because if you're supplementing, you can actually become toxic if you overdo it. So vitamin D is important, and this is the only place where you can get it for $50. Then there's people with blood sugar problems, like they're not quite diabetics, or they are diabetic, but their blood sugars aren't quite right, and they can check their A1C, and it's a long-term exposure to blood sugar. So if your blood is exposed to sugar a lot, your blood sugar's high, what happens with that is your